Hey girl gang, it's Dr. Joy here and you are watching Delivering Joy MD TV. Welcome to Well Woman Wednesday, where today we are talking women's heart health. We all know that February is Go Red for Women's Heart Health Month. And unfortunately, I forgot to wear red today, but I'm still about to break down this heart health issue for you guys. So stay tuned. All right, girls, so let's get into heart health. The reason why I think it is absolutely important for us to discuss heart health is because heart disease is the #1 killer of women in the world, especially in the United States. 1 out of 3 women who die every year die due to heart disease. And many women don't even know that heart disease is really their biggest risk. So a lot of folks think about breast cancer or other types of cancer, but in fact, heart disease is the thing that is killing women in this country. So we're going to talk about it today. I really wanted to kind of give you guys a few of the statistics so that you can be aware about what's really going on in terms of heart disease. So like I said, it's the #1 killer. 1 out of 3 women who die every year are actually dying due to a heart disease related cause. And for Black and brown women, we tend to be disproportionately affected by heart disease. 50,000 Black women every year are dying from heart disease. But when Black women were asked what's their biggest risk, in terms of their mortality, only 1 out of 5 of them said heart disease. So that lets us know that we need to do a better job of education, not only at your doctor's appointments, but just in public health, period. So here is some education that we can all use to live a longer, healthier life. So when we're thinking about heart disease, there are actually several different types of heart disease. I'll list them here. The most common, however, is coronary artery disease or coronary heart disease. And this is where the blood vessels around the heart start to develop these plaques that narrow off the blood flow. And so you can see in this picture that there is a normal blood vessel that's surrounding the heart, and then there's one that actually has plaques that are narrowing the blood flow to the heart muscle. So when the blood flow gets so narrow that the heart muscle does not get enough oxygen, then we see a heart attack. So what happens in a heart attack is that the blood vessels that are bringing blood and nutrients and oxygen to the heart muscle actually get so narrow that there is no oxygen coming to that part of the heart muscle, and that heart muscle starts to die. And so many women also report that they're not really aware of the symptoms of heart attack. So let's just kind of cover that briefly. Certainly chest pain that is accompanied by shortness of breath, pain that's radiating down the arm or up the neck can be a sign. But in women, you can also see some atypical signs of heart attack. And that can be feeling like sense of upper abdominal pain, or what we call epigastric pain, can certainly be a sign. Some women also will just feel extremely tired, like way out of proportion to what you have done for the day. And then, if you're having just intermittent chest pain, these are all things to go and get checked out with your physician. And if you have a history of heart disease or high blood pressure and diabetes, I recommend that you see a cardiologist who's following you to make sure that your heart is staying healthy. Heart disease can strike at any age, and I really wanted to kind of talk a little bit about prevention. So in younger women, even women as young as 20 years old, we have found that some of their arteries are already building up plaque, whether those are arteries surrounding the heart or arteries in other parts of the body. So any artery in our body can actually build up those plaques that cause narrowing and decreased blood flow to our vital organs like our brain. And so when those arteries are so narrow in the brain, you have increased risk of stroke. If you have narrowed arteries that are in your arms or legs, you have increased risk of what's called peripheral artery disease, or where your hands and feet and legs are not getting adequate blood flow. So cardiovascular health is about the heart, but it's also about all the other blood vessels in our body. And so in order to avoid these plaques in our arteries, we have to do a few things. A, we want to make sure that we are eating a healthy diet, especially a diet high in fiber, because that can help us decrease our cholesterol. These plaques are actually made by cholesterol. So keeping a close eye on your cholesterol is very important. If you have high blood sugar, like say you have diabetes or borderline diabetes, keeping a check on that is very important, because sugar can also contribute to the plaques forming in your arteries. So if you have really high blood sugars, that blood sugar coats the inside of the artery and makes that vessel more narrow, and it also increases the risk of forming these plaques. So diabetes care is absolutely essential. Along with keeping up with these things, we need to keep up with our body mass index, or our weight in general. I'm not a huge fan of body mass index in women of color, because that body mass index can be overestimated. I definitely believe in waist circumference. So as women, we want to keep our waist circumference as less than 35 inches. So 35 inches should be our max. I love when I see women who are wearing these waist beads, because we can keep a close eye on what's going on just by keeping those waist beads on. I don't have any, but I definitely want to try some. So that waist circumference is a big deal, because when we develop central obesity, or basically fat all around our middle part, it increases our risk of having what's called metabolic disease. Metabolic disease is what leads to the combination of high blood pressure, high cholesterol, and high blood sugars. Metabolic syndrome is a leading cause of the formation of heart disease. So if you have those things, high blood pressure, high cholesterol, and high blood sugars, you need to be followed by a cardiologist, and you need to be keeping a close eye on your heart. So let's zero in on blood pressure. I have so many members of my girl gang here at my practice who have high blood pressure, but they're kind of like in denial. So we need to get real about this blood pressure, ladies. I have folks that say, oh, I take my blood pressure medicine when I need it, when I have a headache, or if I'm having some kind of symptom of high blood pressure, I take my blood pressure medicine. That's not how it works, girls. We need to take this high blood pressure medicine daily, because the idea is to control your blood pressure all the time. And blood pressure can damage the inside lining of your blood vessels. And when that damage occurs, then we can see these plaque buildups that cause narrowing of our arteries. So if you have been diagnosed with high blood pressure, definitely talk to your physician about medications. If you are having side effects from a blood pressure medication, like you feel tired, or it's giving you headaches, or it's making you cough, talk to your healthcare provider, because there are different blood pressure medicines that can be used, and we can usually find one that will work for you. Now, if you are serious about not wanting to take blood pressure medicine, or you are serious about not wanting to be on blood sugar medication, what to do is really zero in on that diet. So we want a high fiber, low fat, low sodium, or low salt diet, and exercise. Getting moving is absolutely key. You want good heart health, you gotta work it out. So you can hear the train is coming, right? This train is super loud. It's right outside my office window. And then somebody's blowing leaves. So I apologize for the video audio quality here, but I wanted to get this done for you guys because it's such an important topic. And I'm going on vacation soon, so I want to get everything recorded so that you guys still get your weekly content. So anyway, let's review this. The numbers we need to know are our blood pressure, which should be less than 120/80. Blood sugars. Every year, you should be getting blood sugar screening, especially if you had history of diabetes in a previous pregnancy, or if your numbers have been borderline in the past. Blood cholesterol levels are also very important. So once a year when you go to your doctor, we should be checking these, especially if you have a history of high cholesterol. Not all cholesterol requires medication, but if your cholesterol is very high, you may need to be on medication. And exercise is the thing that helps us control all three of those. That 2.5 hours of moderate exercise per week is going to help regulate your blood pressures, help regulate your blood sugars, and help regulate your blood cholesterol levels. So get that exercise in. I know it's hard. I hate doing it, but I know that to keep my heart healthy, I've got to. Let's talk about a few other things that we can do to make sure that we minimize our risk of heart disease. So if you smoke, girl, stop. It's time to quit. If you need help, get help from your healthcare professional. There are medications, there are support groups, there's counseling. Make sure that if you're smoking, that you kick that habit. Blood pressure control, we pretty much hit up. Just take your blood pressure meds if you need to every day. If you've been given blood pressure medicines, take those until you have had a conversation with your healthcare provider and that both of you feel that it's safe for you to stop those. Let's control our weight. I love to eat, but I have to make sure that I am doing things that are healthy for me. If you have high blood sugar, you should be checking that blood sugar regularly, and you should be followed by a healthcare provider who is checking your blood sugars every few months. Let's dive a little bit into risk factors, and this is something that I really want to hone in on so that people are aware of them. If you have family history of heart disease, you've had folks who have had heart attacks, strokes, heart failure, that sort of thing, it's very important to know that. You'd be surprised how many people come in and say, well, I think my mom died from something of her heart, but I'm not really sure. So we gotta do a little bit of probing because, you know, some folks in older generations are not really just about to tell you all their health history. So we gotta ask pointed questions and say, hey, I'm asking because I wanna know how I can control my risk. If you have had a history of preeclampsia in a previous pregnancy, and especially if you were diagnosed with preeclampsia early on, and that's where you have high blood pressures and also high protein in your urine, maybe you were induced early because you had preeclampsia. These are things to note because we now know that preeclampsia is associated with heart disease, and it may be an early marker for heart disease. So if you have preeclampsia during your pregnancy, definitely important for you to be seen for a workup by a cardiologist. If you snore, that is a sign of sleep apnea, and sleep apnea can also be a risk factor for heart disease. So that's something that you should talk with your healthcare provider about. If you have a history of anxiety and depression, this keeps the heart in a high active state. That's why when we talk about anxiety attacks, people will often complain of having irregular heartbeats or really fast heartbeats. So we are keeping our heart in a high stress state, and we're also producing a lot of stress hormone. You know that increased stress hormone can also increase your blood pressure, your blood sugar, and your blood cholesterol levels. That's crazy. So we have to make sure that we are managing our stress, and that if we do suffer from anxiety and depression, that is being treated and monitored. Anemia is another one that many women don't think about. For those women who have really heavy cycles and they're losing a lot of blood and they constantly have anemia, we need to be following that because that can also leave you at risk for heart disease. And certainly an unhealthy diet and a sedentary lifestyle. If you're eating a whole lot of processed foods, a whole lot of carbohydrates, a lot of fatty foods, greasy foods, these are things that certainly make a difference in your heart health. So making sure that you're doing what you need to do to take care of yourself. Make yourself a priority. Make your doctor's visits and your annual physicals a priority. If you have high blood pressure, high cholesterol, or diabetes, or if you have, if you have obesity, if your body mass index is greater than 30, make yourself a priority. Not only change some of your habits, but help yourself be healthier by constantly keeping a check on these things so that you know how you're doing. All right, girl gang, we want your heart to stay healthy. We want you to be healthy. You take care of so many people in a day. Make yourself a priority, because if you don't take care of yourself, how are you going to take care of anybody else? If you have questions about today's topic, go ahead and post those in the comments below. Make sure you subscribe so that you don't miss a single Delivering Joy MD TV episode. And I will catch you on the next Well Woman Wednesday. Peace.